Good evening everyone, welcome to our live session. Today, we have with us a distinguished expert in the field of medical oncology, Dr. Dipanjan Panda, Senior Consultant. Thank you for joining us, Dr. Dipanjan. To kick things off, Dr. Dipanjan, could you shed some light on the role of medical oncology in treating common cancers?
Thanks, Maitri, for asking this question. This is important. So, as you know, cancers can be treated by means of surgery as well as radiation. However, medicines, anti-cancer medicines, do have a great role to play in treatment of cancers, both in a localized cancer as well as cancer which has metastasized or spread in different places. So, how anti-cancer drug works? Anti-cancer drugs works by mostly preventing cell division. As you know, the cancer cells, unlike normal cells, rapidly divides and grow much faster than the normal cells. So when these anti-cancer drugs, they prevent cell divisions, leading to the growth arrest and subsequently death of cancer cells. Cancer cell drugs can be of various types, and they work in the different phases of cell divisions. They can do DNA methylation, arresting the cell division by affecting the microtubules, and sometimes they also work on different enzymes like tyrosine kinase. But altogether, they have the common goal in arresting cell division.
That's fascinating, Dr. Dipanjan. Could you explain to our viewers how medicine works to specifically target and kill cancer cells while minimizing damage to healthy tissues?
As I have explained you that in a normal body, most of the cells are in a quiescent state and they are not dividing. Unlike normal tissue, the cancer cells rapidly divides. That's why they grow and they ultimately forms a ball-like structure called tumor. Tumor basically means swelling. Now, as these anti-cancer drugs work on preventing cell division and leading to growth arrest, so they preferentially target cells which are dividing and growing. And since most of the normal cells in our body are not dividing, they are spared. However, there are two very well-known exceptions. One is blood cells in our body, especially there are white blood cells, and the mucosal lining of our gut, because these cells are rapidly dividing, and hence most of the common conventional chemotherapies affect these two, leading to low blood count as well as mucosal ulcers. Of course, nowadays there are newer drugs like targeted therapies and immunotherapy has come, which does not work like this. Like targeted therapy acts on various enzymes and receptors, thus leading to decrease in cell nutrition or cell growth. And immunotherapy acts by increasing our body's immunity to recognize the cancer cells, thereby killing them.
It sounds like a delicate balance. Moving on, how do you manage the potential side effects of medicines?
There is no medicine which does not have any side effects. The common side effects of anti-cancer drug or conventional anti-cancer drugs are namely nausea, vomiting, loss of appetite, appetite leading to loss of weight, mucositis, neutropenia, thrombocytopenia, anemia, fatigue. Of course, there are specific drugs which have got specific toxicities, like immune checkpoint inhibitors may lead to autoimmune reactions. Different targeted therapy also have specific side effects like hypertension, proteinuria by bevacizumab, skin rashes by cetuximab, etc., etc. Before managing any drug side effects, you must know what are the common side effects of those drugs, and depending on that, either you can treat or you can caution the patient that these side effects can happen. Now, like nausea and vomiting are the most common side effects. Most of our patients, we give antiemetics both before and after chemotherapy, IV as well as oral. To prevent fall in blood count, we give granulocyte colony stimulating factors, and sometimes we give also thrombopoietin and erythropoietin injections. However, there are specific side effects of drug, like doxorubicin can have cardiotoxicity, so is a drug called trastuzumab. Bevacizumab can cause proteinuria. So we must know and be cautious about these side effects which can happen on prolonged uses of this drug. So we also keep the patient under close observation. So it is not a fire and forget situation. As you are giving this drug, you need to explain patients about the side effects of the specific drugs which you are going to use, both in short term as well as in long term.
Dr. Dipanjan, can medicine cure cancer completely without the need for any surgery?
Well, you must see the cancer can be broadly divided into two types. One is solid tumors, one is liquid tumors or hematological malignancies like lymphoma, leukemias or myelomas. For lymphoma, leukemias, myelomas, you really don't need surgery. Usually with medicine, you can cure them. However, for solid tumors, surgery still remains an important treatment, especially in a localized disease where it can work to reduce the tumor to such extent where the microscopic disease can be taken care of by medicine. So in nutshell, in solid tumor which is localized, medicine alone cannot cure it. We need a local therapy like surgery and radiation therapy. However, in hematological malignancies, drug remains the treatment of choice, and in most of the cases it can alone cure the cancer.
Fascinating insights, Dr. Dipanjan. How have advancements in medical oncology improved its effectiveness and reduced potential side effects?
Well, that's a very good question, Maitri. Medical oncology has grown in leaps and bounds in the last 2 decades, and I think we are seeing a paradigm shift from conventional cytotoxic chemotherapy to more targeted therapy, which has got less side effects and more specific result. And we also have now got that immune checkpoint inhibitors. There are also treatment like gene editing, gene splicing. We are seeing CAR T cell therapy in hematological malignancies. And not only in medicine, also the side effects of medicine like nausea and vomiting. Now we have got much better drugs like apripitants or neurokinin inhibitors which can effectively control the side effects of nausea and vomiting. There are also, so we can not only treat the cancer better, we have less side effects, and we can also have the medicine to control these side effects. However, medicine is only part of the treatment. It is the positive attitude of the patient and the family support which makes a big difference. So as an oncologist, we are living in an exciting time, and in many of the cancer, when detected early, we can cure, provided the patient comes to us early and they have a positive attitude and the family supports them to complete their treatment.
Dr. Dipanjan, are there any emerging applications of medical oncology that our viewers should be aware of?
I think I have already explained that medical oncology is a burgeoning and subject with a lot of emerging treatments, and especially for diagnosis and management, we are taking help of technology. The two most exciting technology what I see, one is artificial intelligence and one is telemedicine. So in a country like ours, which is large, vast, and the number of qualified doctors are less, telemedicine can help to connect a specialist sitting on a large city to a physician in a remote corner of the country and helping the treatment in real time to reach them. Artificial intelligence can help us with the help of technology to detect cancer in early, to plan the treatment more effectively, leading to better result. So along with the growth in medicine and the type of drug, along with technology, I think these two things can really help us to reach our goal of treating all the cancers in early stage and cure them.
Before we conclude, do you have any last message for our viewers, Dr. Dipanjan?
I will always tell my people that be aware, be alert, but never be afraid. Cancer is curable. If you suspect that you have cancer, or you suspect that someone you know or love may have cancer, please ask them to see a local physician.
Thank you, Dr. Dipanjan, for sharing your expertise with us today. And a big thank you to our viewers for tuning in with such thoughtful questions. Remember, knowledge is a powerful tool in the fight against cancer. Take care, and until next time, stay healthy.